Coming up next on For Your Health, physical therapists are pursuing doctoral degrees at UCF. We'll talk about what that means to the profession.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.
Hello, everyone. Welcome to For Your Health. I'm Charna Wiese. Ed Highland is out on assignment. On today's show, we're looking at physical therapists and the work they're doing. You may not realize it's a doctoral field or that physical therapists are performing humanitarian work. Or maybe it never occurred to you that a physical therapist might be able to help you with that nagging neck pain. We have two guests joining us today. Dr. Jerry Smith will be here to talk about how in recent years, physical therapy has started demanding a higher level of education. We will also be joined by Jennifer Tucker, who was part of a fascinating humanitarian trip to Jamaica. But first, anyone working with a laptop these days knows that neck pain can be a relentless annoyance. If you battle any kind of neck pain, you'd probably consider yourself a candidate for treatment. But as Alicia Callanan Mandigo reports, selecting patients for a treatment protocol is not as clear-cut as you might think.
I want you to hold that there for about 15 seconds, okay? And we're gonna repeat that process 2 times. Okay.
Neck pain. It seems we've all struggled with it at least once. Some of us end up with neck pain severe enough to go to the doctor.
15 to 20% of our patients are neck patients. I mean, if it's a joint, we see it, and neck patients are all the time.
Does that cause you any pain?
Yeah.
Okay.
The trouble is, it's hard for physical therapists to know what will help a particular neck pain patient. Physical therapist Bill Haney has treated a lot of neck pain. He's also a big advocate of exercise programs. So he applied for a grant to try to determine which neck pain patients would benefit from exercise.
As a physical therapist, of course, I treat neck pain all the time, and certain interventions seem to work really well with some patients and not with others. And sometimes that can be frustrating because, of course, as a physical therapist, I always want to get all my patients better, but we had very few tools, or as physical therapists, had very few tools to help predict which patients are more likely to respond to a certain intervention.
The study, which is funded by the American Physical Therapy Association, will enroll a total of 90 people over an approximate 2-year period. It will look at lots of variables, including what caused the neck pain. A lot of us are struggling with neck pain these days because we're spending the day hunched over our laptops. And it can become severe enough that you will end up in physical therapy. But there are a couple of things you can do to help prevent that. One thing is make sure you're positioned properly. You can even get a stand that will make sure the laptop is in the correct position. Also, take breaks. Get up, walk away, do a few neck rolls. Those simple things could help you avoid a visit to the doctor. But if you do end up here, will an exercise program help?
Well, at this point in time, we're not really sure. So, of course, neck pain can stem from a ton of different structures within the neck. And actually, we're looking at those different variables as possible predictor variables. So perhaps if you were in a car accident, you're more likely to benefit from exercise. Or perhaps if you have neck pain associated with posture from sitting in front of a computer, you're more likely to benefit from exercise. But right now, we don't know. So those are actually some of the variables that we're tracking to see if we can make a predictive relationship.
Justin Talbot is one of the researchers working on the study.
Everything that we're doing has a process, and we want to make sure that process is the same with each patient. So, not all neck patients are candidates for this study, so it's something that we have to make sure that they are, so we have to kind of go through that process. So my role is to kind of see those neck patients when they come in, those cervical pain patients, and assess them and see if they are candidates for the study.
Those enrolled will be prescribed an exercise program, which is common in physical therapy. But no one really knows what happens once the patient goes home.
Wouldn't it be interesting to have a study that says if you are more compliant with your home exercise program, the probability you're going to benefit from this treatment is significantly higher? And at this point in time, we don't have that research to tell us that.
If exercise proves beneficial, it will be a relatively easy solution to what can be a pretty debilitating problem.
It's estimated at least 2/3 of us will complain about neck pain at some point in our lives. Roughly 10% of those cases will be chronic. Whether you're a student trying to choose a major or a professional considering a career change, no doubt you thought a bit about what jobs are recession-proof. One field that so far is proving to be recession-proof is physical therapy. For that reason, it has become a very competitive field. Joining me now is Dr. Jerry Smith from UCF's Department of Health Professions and the College of Health and Public Affairs. Thanks so much for joining us, Dr. Smith.
Thanks for having me.
You know, that's been a discussion in our home. My oldest is 1.5 years away of going to college, and it amazes me that on a lot of applications they ask these 15, 16-year-olds, what do you want to do? And he doesn't know, but I always tell him, you know, this past 4 years have proven to us that if you can have a position that is not really terribly affected by the economy, you are very lucky indeed. Physical therapy, there's always going to be a need for them.
That's true, and I think it's going to be true for the foreseeable future. If you just look at some very basic statistics, the government is predicting that about 65 million people will be retiring in the next few years and entering into the phase of life when they have chronic diseases that need physical therapists.
And we have the baby boomers.
Absolutely.
So, and they are the kind of people that we'll go and look for.
They have always.
There have been people that don't look.
My generation has always demanded things, and we've always gotten it. And I think the time is going to come when we will demand health care, and physical therapy is part of that.
Now at UCF, your first class of doctoral physical therapist from here has graduated.
That's correct.
That's incredibly exciting for you and your college.
Yeah, it was nice to be a part of it from the very beginning, to write the proposals, to take it through the various committees at the university level and go all the way to Tallahassee to get it through the Board of Governors. So it's been very gratifying.
So you saw the need. This is something that was part of your planning. What caused this need for the doctoral program?
Well, there have been a lot of things, but I think the major thing that's driving it is over the past 20 or 30 years, there's been an explosion of knowledge regarding health and health care, and to simply keep up with that explosion, therapists have needed to have more and more education. So we're responding to that need. And in many respects, I always say to my students that they have probably the toughest job in healthcare. They not only need to know what every other healthcare provider is doing, but then they have to learn their own disciplines. Because very much of what physical therapists do is simply educating the patient. And to truly educate them, they need to be able to talk all the lingo.
And you have to get them past an impairment. You have to get them past a time when they may be frustrated, they may be in pain. You really, as you had said to me earlier, you really have to be a people person.
Absolutely. I think most people tend to gravitate to physical therapy because at some point in their own life, either they've had a short-term disability or someone in their family's had a disability. As an example, my father had a stroke when I was 14 years old. That was a devastating illness not only for him but for the family. I myself injured my knee wrestling in high school and had to go through surgery and rehabilitation. So most of our students have that kind of background, so it gives them a little bit of foreknowledge as to what the patient is going through, and they tend to be much more compassionate because of that.
You know, you talk about physical therapy and experience with it. I joke when I do these medical shows, I've had so many issues from car wrecks and horseback riding accidents, etc. I've had a lot of experience with physical therapists, and when I did, it almost seemed to me it was not only a science but an art as well.
Yeah, that's very true. You have to be able to read the patient and give them what they need. I basically say the best therapist is a chameleon. They can change their colors to match their surroundings. And you have to be able to talk to the university president as well as talk to the local laborer. And to be therapeutic for that range of people, you need to be very well-rounded.
I've also read that in surveys of job satisfaction, one from the University of Chicago, other than the clergy, that physical therapists rate their job as being highly satisfactory, higher than many, many other types of professions.
Well, I think that's true, and it's certainly been my experience. You get to meet fascinating people from all endeavors. They all have stories that are all very interesting, and as I say, you get to change your own colors to meet the situation.
And you get to stay with them and see your results as well.
Yeah, we tend to work very closely over extended periods of time, which is very different than most healthcare providers who see the patient, tell them what to do, and
Hope they do it.
come back in a couple of weeks and let's see how it worked out. The therapist, on the other hand, is working directly with the patient as cheerleader, as guide, as father confessor, and sometime to crack the whip on them.
As coach.
As coach.
Now, this doctoral program, it is not a PhD program.
That is correct.
It's a DPT program?
Correct. A Doctor of Physical Therapy program, and as such, it's really comparable to other clinical doctorates. The MD degree is a clinical doctorate. It's not an academic degree. The PharmD, the DDS, the psychology degrees, they're all really clinical doctorates, and the DPT is the same thing.
So when you get that DPT, you have worked with patients, you've had internships, you've had clinical experience. It's not all book learning. You are really ready to get out there and start your career.
Correct. As part of the curriculum, our students do a total of 30 weeks of full-time clinical affiliations. Now, we intersperse those affiliations throughout the curriculum, so it's not directly comparable to medicine, where the first 2 years of medical school are didactic, and then the last 2 years are clinical. Ours are interspersed throughout.
That must really make it so much easier to go into the workforce after they sit for the exam.
Yeah, exactly. We always say that the affiliations are the longest job interview you're ever going to go on. So most of our students, by the time they graduate, have lined up a job 6 months to a year before they graduate. And they're getting the hands-on practice that they need to successfully pass their boards.
Now here at UCF, there's the 4-year degree, and then you go straight to the DPT, which is another 3 years, 7 years altogether. No master's program anymore?
There is not a master's program at UCF, and nationwide there are relatively few still on the books. About 90% of the entry-level programs have already gone to the doctoral degree.
And once they get that degree, maybe hands-on with a patient is not for them. Maybe it's not. They can do other things. Research, perhaps?
Absolutely. Research is a huge area. Most of my career has been spent in the research arena. I came from a background of practicing for a number of years, and then there were a couple things going on in the research world that turned me on and changed my career dramatically.
How about that 7 years? Do they look at that and say, that's a long time, that's close to med school, that's law school, or is it, wow, I'm going to be really ready? The last 3 years almost seems like you're working in your career already.
You know, I think most students look at it as those 3 years are going to go by in a heartbeat, and they really do, because our program is really 9 consecutive semesters. It's not like medical school where you have the summers off and you go out and do something else. Once a student enters our program, we own them for the next 9 semesters.
So it's really like doing the career.
It is.
And I've also noticed from your first graduating class, you had quite a few women. You think of this as sometimes physical therapy, you need a lot of strength, you're dealing with patients, but it's definitely, obviously, a field for women.
It has been traditionally. There have been many, many women throughout the years who have become physical therapists. And I think nationwide right now, about 2/3 of the students are women. So it is certainly a female-friendly profession.
If you had, being a physical therapist yourself, with a doctoral degree, and if you had to say to somebody, let's say I'm trying to decide whether to do it, what would your best experience be from your life to convince me, yes, this might be for me? Never a dull moment?
I've had so many great experiences. It's hard to say just one, but working with patients who've had devastating traumas, whether it be a spinal cord injury that's left them paralyzed, head traumas, major motor vehicle accidents where there have been multiple fractures, and then to see the person basically reintegrating themselves into society is always, it's always heartwarming.
And I'm so glad that you're here to tell us about this and to spread the word. And I guess not being able to pick one thing is probably the biggest endorsement that there is, that there are so many. Dr. Smith, Dr. Jerry Smith, thank you so much for joining us. It was really enjoyable.
My pleasure.
For me to meet you. Again, I've been talking to Dr. Jerry Smith. He's from UCF's Department of Health Professions in the College of Health and Public Affairs. Still to come, bringing physical therapy to Jamaica. That's right after this. We're glad you're back. Joining me now is Jennifer Tucker from UCF's Health Professions Department in the College of Health and Public Affairs. She was part of a group that traveled to Jamaica on a humanitarian trip, and a trip that proved to be rather eye-opening for a number of people in the group. Thanks for joining us.
Thank you for having me.
You know, for those of us who have been fortunate enough to go to these kind of communities, it's so close, a few hours away, a couple of hours away, and you land there and you are truly in a different world. We don't realize how blessed we are. What started you going to Jamaica on physical therapy humanitarian trips in the first place, Jennifer?
I actually was not certain what I was getting into. I was a new graduate. I was working at Florida Hospital, and they came into our pediatric section and asked, did anybody have a passport and were they willing to travel? And so on the first trip,
a risky question. It's like, yeah.
So on the first trip, I went with a team of physicians. They weren't sure if physical therapy could make an impact in that community. So literally what they did was they put me in a van and drove me from children's home to children's home, asking if they needed a therapist, and they would leave me for the day and
Just
come back
you.
and get me, just me,
Oh my gosh.
at the end of the day. So the first trip was somewhat overwhelming to determine, could we make a difference?
I think so. I mean, there must have been hundreds of kids.
There were hundreds of children that had really no care, nothing like what we see in the United States. And so over the course of the 2 weeks that I was there on the first trip, I began to envision a way that we could work together to really empower the caregivers, because that's who we needed to empower. We could work with the children, but we needed to make a difference, a bigger difference in their lives through the women that were taking care of them.
And this was 10 years ago.
This was 10 years ago. The program evolved. I worked with several other pediatric therapists, not really knowing how life would unfold. And as it unfolded, we began to take university students with us in small groups. I became faculty at the university, and I had 13 students that wanted to go. And we weren't sure if that was even plausible. Could we take 13 students in and really continue to make a difference and have a quality program? So we took a leap of faith and booked a flight and traveled down as a large team and had an amazing experience.
Don't you feel that sometimes when you're diving into something with all the most wonderful intentions and you don't know if it's going to work is when it works the best?
It does. I was really very, very nervous. It's a very emotionally intense situation for anyone, but much less for students. And to go into that environment and be able to be non-emotional enough to get through the day and have it be a good experience, but emotional enough to have a meaningful impact. And the students blew me away. Their ability to function was amazing.
The first time I was in a situation like that, we went to El Salvador, and we went to an area where there were people literally living in boxes with made of siding and cardboard. And when we arrived there, all the men were working, so it was all women and children, and the children saw our car and they ran to us. And at first it almost took your breath away, because you're used to seeing, we have so much. And here are these children without shoes, in rags that were basically old American t-shirts, and they were so happy. And then we did see issues, medical issues, just there in the countryside. So you were actually in homes. These children aren't necessarily orphans, but are they there because their parents can't handle them because of their medical problems?
They are there because there is nothing within that community to support their family to raise them at home. There's not any formal special education. There's no therapeutic services like we would have here in the United States. So they're already in a poverty-stricken environment, and then it's a choice for them to make. Do they continue to stay home with that child and have even less, or do they make a really painful decision and place their children in some type of facility so that they can continue to work and in the hopes that their child will have a better life within that environment.
What kind of things do you see?
We see everything from developmental disabilities, diagnoses that you would see here in the U.S., children with Down syndrome, children with spina bifida, children that were born prematurely, children that were born addicted to drugs, some children that have had meningitis or brain injuries that there's not a lot of parent education, so parents don't really know what to expect on that journey. And as their children get older, the needs become greater.
Now, you go back year after year.
I do.
And you see them year
I
after
do.
year. And you
I
can
do.
see, I imagine you can't really, it's just that week that you're there. And you can't give them treatment, but are you training the women that run the homes
Yes.
to do it?
Yes. What we do, we come in and we do an initial screening. We just check in on all the kids and see where they're at. I have notes on all of the children on where they've been functioning. So we go in and we screen them and we see where they're at, and then we pick one need that we believe that we can teach a caregiver to address. The list is much, much longer. There could be 15 needs, but we pick the one that we think is will make the most impact. And then we'll train the caregiver on how to do that activity, whatever it is, to improve the quality of life. So we've seen children become ambulatory or able to walk because of stretching. We've seen children become mobile in wheelchairs just by picking one thing that we can teach a caregiver to do within the scope of a very busy day.
The women running the place must look at you guys as if you're guardian angels to teach them, because there's nothing more frustrating, even as a mom or somebody with a child, that you don't know how to help. You want to help and you don't know how to, and you gave them the tools.
They're wonderful women. I think that they are initially very guarded. We have a wonderful relationship because we go back again and again. I think they're very guarded. They're doing the very best they can, but they recognize their own limitations. So I think the nature of repeated trips and an ongoing relationship has really allowed us to develop a ongoing relationship where it's empowering, we're empowering them, but they're now becoming empowered and being advocates for the children and themselves on what their needs are.
They learn to trust you, and they learn that you're not coming there judging them, you're
Right.
coming there because you have something to teach them.
Right.
So you've seen over 10 years some of these kids turn into adults.
Yes, dramatic changes in kids. I've seen them grow up. The same children that I saw on the very first trip, I still see when I go back, some of them.
Now, when I was in El Salvador, we were covering a war, we were covering an earthquake, and we went to some of the field hospitals and even the hospitals in the city. And what struck me is we're so used to high technology here. And there were things that they put together for traction, was bricks with string tied with a handmade pulley. And I'm sure there you probably couldn't go with the tools you need. You probably had to make the tools.
The students' greatest lesson on the trip was they had no idea what you could do with duct tape. Because we can do anything with duct tape. We can fix wheelchairs with duct tape. We can create specialized seating with duct tape because it's readily available and it's cost effective. So between duct tape and cardboard, we can do a lot. We do take equipment with us, things that have been donated, and we'll repurpose them there. But you're right, there's nothing high tech. Things that would be very commonplace here that we would use, they just don't have access to. So it's really making the most of what's available.
So you go to more than one home?
Yes, we do. We'll work with a home until we feel that they are able to be good self-advocates, and then we'll move to the next one and we'll keep checking in with the previous. So right now we have 2 homes that when they know when we're coming, they'll let us know if they've had a new child that's admitted that they want us to check out or that they have a need for equipment, and we'll make a point to stop by and spend a morning, but then we'll spend the bulk of our efforts in the group home that we're currently working to better the lives of the children and the caregivers.
The students that you bring, are they undergrad?
No, they are the doctoral and physical
doctoral?
therapy students. So they're actually students that I have just finished teaching pediatrics to in the fall, and they go and they've done amazing things in the span of a week, even halfway through their education. They're about halfway through the program at that point, and they just can make a tremendous difference.
I just went as a journalist, just reporting on the situation. We brought them stuffed animals, we brought them clothes and things, but I didn't really do anything to help, and it changed my life. I can't imagine what impact it had. You're helping them, but they're probably changing and affecting your life and your students' life even more.
I think it's definitely goes both ways. My hope for the students, for taking our students in the program in physical therapy, is to plant the seed that they can make a difference, and that it can happen in their own community, or it can happen 2 hours away from here. And they tell me repeatedly how that experience changed the course of their education and their future careers.
And the good news for them is you would go every year and hopefully expand the program?
We will expand the program. Our first class just graduated in May, and we have identified trip leaders for future trips.
So you have already.
So the cycle continues.
Now, do they get to go back? If they've gone once, do they get to go again? Or
They
you
do
have
not.
to give everybody else a turn?
They don't get to go as students again, but they can go as trip leaders once they've graduated. So it's a part of our program's identity that's a second year. It's a second year event. And the students know that in the second year, that's when they have the opportunity to go, but they all know that they're welcome to come back as trip leaders after graduation.
So Caribbean now?
Caribbean
Next,
now.
Latin America?
We're looking at Latin America. We're looking at opportunities in Costa Rica, Mexico, Argentina to identify, because there are children there in as great a need as the children that we're currently dealing with in the Caribbean.
I bet you can't believe it's been 10 years.
It's hard to believe. It's hard to believe, but it's been a wonderful, wonderful blessing for myself and now my students.
If you had one wish, something you could bring to them next time would be hope, or something actually concrete?
I wish I could offer them the gift of education. That's the thing they're missing the most, and that's the piece that I can't offer. But hope is a good start. They're happier because we're there, and they have more independence when we leave. So that's a starting point. That's the next step to getting them to education.
Thank you so much
Thank
for
you
joining
for
us
having
and
me.
for what you do for them.
Thank you.
And maybe, who knows, we get the word out. One change leads to another, two leads to another, two leads to another.
It works through a partnership, so it takes all of us.
Thanks for joining us.
Thank you.
Again, I've been talking with Jennifer Tucker from UCF's Department of Health Professions within the College of Health and Public Affairs. That's all the time we have for today. Thank you so much for joining us. I'm Charna Wiese. We'll see you again next time on For Your Health.
This program was made possible by a grant from the UCF College of Health and Public Affairs, which promotes excellence in undergraduate and graduate education, research, and community service in health-related professions and public affairs.